Hey guys, Sam Stein here, managing editor at the Bulwark. I am joined by America's foremost public health expert, TV personality, great guy all around, Dr. Vin Gupta. We are going to be talking about RFK Jr. and some comments yesterday that got my attention, got a lot of people's attention about vaccines. But before we get into that, as a reminder, it's always important for you guys to subscribe to our YouTube channel. We really appreciate it. So please go press that button. Vin, how you doing, man? You good?
Hey, Sam. Great to be here with you.
So I wanted to talk about last night. There was a TV segment involving Howard Lutnick, who is running the transition for the Trump campaign. And he was asked about RFK Jr. because it's been in the ether that RFK Jr. is going to get a prominent health post in a Trump administration should Trump win. Not just in the ether. Robert Kennedy has said it himself. He said he's been promised a prominent health position in a Trump administration.
You know, that President Trump has promised me is control of the public health agencies, which are HHS and its sub-agencies, CDC, FDA, NIH, and a few others, and then also the USDA.
Lutnick was asked about this, and he sort of downplayed that he would get HHS. But I want to play for you what he did say, which got a lot of our interest.
RFK Jr. He said that Trump has promised him control of the public health agencies, HHS, which would be also, CDC, FDA, USDA, all of these agencies. Is that true? Has Trump promised him basically the HHS job?
So I spent 2.5 hours this week with Bobby Kennedy Jr. And it was the most extraordinary thing because let's face it, we've all heard on the news all sorts of sort of snarky comments about him. And I said, so tell me, how's it going to go? And he said, why don't you just listen to me explain things? And what he explained was when he was born, we had 3 vaccines and autism was 1 in 10,000. Now a baby's born with 76 vaccines because in 1986, they waived product liability for vaccines. And here's the best one. They started paying the people at the NIH, right? They pay them a piece of the money for the vaccine companies. Wait a minute, let me finish. And so all of these vaccines came out without product liability. So what happened now? Autism is 1 in 34.
Okay,
amazing.
Neither of us are doctors. Vaccines are safe. RFK,
Why do you think vaccines are safe? There's no product liability anymore. They're not proven.
Kids get them and they're fine.
Why do you think they're fine?
But because they're proven scientifically to be so.
How about this? There was 1 in 10,000.
They go through
rigorous
amounts
there.
of tests.
So, first of all, the idea that Howard Lutnick has 2.5 hours to spare to talk to Bobby Kennedy is itself insane. That he would take 2.5 hour conversation and suddenly fundamentally revamp his entire thinking about vaccinations is also a little bit alarming. Well, really alarming. Let's just be honest about that. But I just think you're a public health expert. You've dealt with this stuff. This is serious shit. I just kind of am curious about your take on this.
I think what Howard's doing with what I've seen RFK Jr. do is cherry pick data and try to draw correlations without causation. And that is that's the medical explanation here. Let's look at 2 data points and say that they're related and one is causing the other. And that's just not the case here. And it's also just the height of ignorance. And frankly, I worry about the comprehension abilities of some of the folks that are somehow drawing a correlation between increased rates of autism and vaccines. One, because it's been proven that these increased rates of autism that we're seeing in relative terms have a lot of proven causes, one of which is not vaccines. There has been several studies done showing that vaccines, actually, there's no link between, say, the measles, mumps, and rubella vaccine and the development of autism as a child. It's been debunked many, many times. And so this notion that now we're having to navigate this red meat issue because they're talking about it and they know that it's going to resonate perhaps with folks that are not as read into this topic. It's unfortunate because this is what misinformers do. They go after topics with sort of trigger words and they try to persuade people. And as a physician, as a pulmonologist, this has been troubling for the last 5 years. We've seen this rise in misinformation, especially with vaccines, and it continues. But here's the reality. For those that are listening, autism rates have increased, no question, in relative terms, but they've increased for a variety of reasons. One, we know that advanced maternal age for the birth of a child, mom's older, and moms are tending to be older as they're birthing their children. We know that maternal age has increased over time, variety of reasons. That's a risk factor. We also know that for all of those that are concerned about environmental health and how it impacts human health, we do know that there's a link between increasing rates of air pollution, other toxins in the environment around us, and the development of autism. So those are two key risk factors that have obvious trend lines that are headed in the same direction, portending an increased risk of autism. Again, advanced maternal age and worsening environmental health. Those have been demonstrated to be increased risks for the development of autism and could be potential explanations. The other thing too is we're talking about it more, and we're looking for it more, and we're likely, as with many other conditions, diagnosing it more because we're talking about it more, and it's more clinicians are more vigilant about it. There's just much more awareness, and what we know is relative to the population, Sam, autism rates amongst children are actually relative to the growth of our population. In relative terms, they're far less than they were, 60, 70, 80 years ago. And so this notion that somehow we have more childhood vaccines as part of the childhood vaccine schedule, and that is somehow causing increased rates of autism, that has been debunked consistently. Vaccine experts across the spectrum have established that, regardless of whether we're talking about the polio vaccine, the measles, mumps, and rubella vaccine. Both of those vaccines have gotten a lot of scrutiny, are under attack, frankly, by elements of the far right. And yet these have been studied rigorously in a controlled environment, because none of us as professionals in white coats want to do something that would ever harm our patients.
Right.
It's the notion that somehow if you're left-leaning and you're a healthcare professional, that somehow you would subscribe to something that would be willingly harming your patient. I mean, that's the question I have for the RFK Juniors of the world. Why would we want to do that and in some way disobey?
Well, they would argue that you're in the pocket of big pharma. I mean, that's what they would say.
Right, exactly. And this notion of product liability too. I mean, Howard Lutnick brought that up a few times. That is just a wild assertion that somehow there's no accountability on the safety of vaccines. I'm glad that there was some pushback in that interview, but frankly, it wasn't strong enough.
Yeah, I just want to hammer that point again, which is that it's not that this has not been studied. In fact, it's been rigorously studied. It might be one of the more studied elements of vaccinations that we have, is whether they can have adverse side effects. And time and again, peer-reviewed data has shown they don't. Why do you think, this is more of a political question, but why do you think that these viewpoints have increased credence in our politics? It used to be that they were considered on the fringe, but now not so much. Now we're seeing that even the transition chief of the Trump operation is, after 2.5 hours of conversation, adopting them.
Well, I think this goes back to some fundamental things that we should all agree on can be improved upon. And so I am in no disagreement with RFK Jr. and elements of the center right when some of them say, hey, we need to have some serious reforms for some of our health agencies, specifically how we communicate, what we communicate, and what are our priorities. Right. I do think that there's an agenda here that 80%, Sam, of America agrees with. It's the other 20%, largely on the far right, that makes no sense, that scares us off, and it's extremist. But there's an agenda here that a vast majority of Americans can agree with, and I think that's where hopefully we can find some common ground. For example, I find it astonishing that the FDA and I laud the progress of the FDA over the last 2.5 years. The FDA has arguably been the most accomplished FDA that we've ever seen, at least in my lifetime, under the Biden administration. That's done more in terms of putting great products, OTC, Narcan, birth control, more in the at-home environment than we've ever seen before. So the FDA has done a lot of good for the American consumer, whether we're talking about food safety, whether we're talking about medical products. But this notion of going for the red meat issue, for which, frankly, a lot of our leading healthcare officials who have podiums are not nimble to push back on, going for the low-hanging red meat.
Well, that's the thing, yeah. I mean, that's the thing. It's like Howard Lutnick is kind of an easy mark in this sense because he admits he doesn't have the expertise, but he does get 2.5 hours with Robert Kennedy and suddenly he's convinced. I want to play the second clip because he and Caitlin Collins sort of talked about what this would mean in practical terms a little bit, not truly, but
Sure.
he gets into the issue of trying to essentially yank vaccines off of the market. And let's play that clip so you can react to that, because I'm kind of curious what this actually would look like.
These things are unsafe. He says, if you give me the data, all I want is the data, and I'll take on the data and show that it's not safe. And then if you pull the product liability, the companies will yank these vaccines right off of the market. So that's his point. He's not trying to do anything but things that made sense. And look,
this is not where I thought this was going, because
well, I spent 2.5 hours.
RFK Jr. is a vaccine skeptic. He pushes lies about vaccines, and I don't even think if Republicans.
Why do you think he pushes lies? Why you said
I don't know why
you
he
said
pushes
I'm not a
them.
scientist and you aren't. So
Yeah, but
he just wants
scientists
data.
say he pushes lies.
Oh,
here's
but
my
scientists
question
who are
on
paid
this.
to say he pushes lies. I mean, let's give him the data. I think it'd be pretty cool to give him the data. Let's see what he comes up with.
Okay.
I think it's pretty fun.
He pushed conspiracies about COVID. He had to apologize for tying vaccine questions to what happened in Germany during the Holocaust.
I promise you, I have
so
not
I don't
looked
think
at all
he's
the
the leading
things he
voice
said.
that anyone's looking at for
he
unhealth.
said Roundup. Remember Roundup?
But you're saying he would.
All right. The first part is what I'm kind of curious about. So what is that? What is he talking about there in terms of product liability? The manufacturer will say, nope, not worth it. Going to yank this from the market. What does that mean in real world terms?
This question of product liability and vaccine liability protections afforded to vaccine manufacturers is an important one to speak about in factual terms. And there is something called the National Vaccine Injury Compensation Program, and it's an alternative to the tort system for resolving these vaccine injury petitions. So if somebody is claiming that they've been injured by a vaccine or had a serious adverse event, they have to first exhaust the remedies through this vaccine injury compensation program before they can pursue legal actions against manufacturers or administrators of these vaccines. And so it's also important to note that these liability protections against the manufacturers are not absolute. And so there is a course of escalation here that if the National Vaccine Injury Compensation Program does not resolve an issue that is deemed legitimate, that there are legal recourses here. So this is not absolute. And it's important to recognize that this is not some sort of broad exemption for manufacturers, that they are accountable. That's number one. Number two, again, for those listening out there, those of us that actually care for patients worry about all sorts of potential risks to our patients. And if there is a concern that a vaccine might have caused a serious adverse event, it can in some cases. We know that some people have allergic reactions, and we want to be made aware of them. This notion that somehow some doctors or some in the healthcare field are not worried about that or are somehow conflicted is unfortunately just that sad, tragic messaging. We all worry about our patients and the risks they face, potential risks they face. And if they have a predisposition to an allergic reaction from a vaccine, we need to know about that, be prepared. And so there isn't, or nor should there be, anybody in the healthcare field that isn't eyes wide open about all the potential risks to patients and to be proactive and vigilant. We are doing the best we can to make sure that we're producing vaccines as safely as possible and that they're going to be as effective as possible. But we have to do so with certain guarantees of protection, especially in this environment that we're not going to, face 20,000 different sort of legal complaints and lawsuits. And so that's the product liability issue.
And so basically, Kennedy wants to end that, allow people who say they've had adverse effects from the vaccines to sue the vaccine maker and hold them liable, at which point Lutnick thinks those vaccine makers will say this is not worth it. And that would be in some ways an admission by the vaccine manufacturer that their product is in fact problematic. And then those vaccines will then be taken off the shelf because no vaccine manufacturer will want that liability. That's essentially what they're talking about, right?
That's essentially what they're talking about. And it's a dangerous talk track in particular because, there is no data unfortunately, Sam, for their sort of point of view that they're peddling on national TV. There is no data to substantiate that, say, take the annual flu shot or take the measles, mumps, and rubella vaccine that I think is kind of the classic example of something that's under attack right now. It has become the purview of those that are seeking a platform politically on TV, in social media, to really double down to 20 to 30% of the American audience that is willing and is receptive to this type of information.
Well, I don't know, man. I don't know if it's 20 or 30% anymore. I honestly don't.
Might be more. Yeah, no, and that's the worry here, is that, those that truly believe.
Because keep in mind, I mean, Trump started, let's just remember where Trump was in COVID. His vaccine manufacturing and the pushing out of the vaccine was considered a triumph for him, right? I mean, that was the idea.
That's right.
Now he doesn't talk about it anymore. In fact, he kind of distances himself from it. I think there is a strain of anti-vax behavior that has taken a foothold in the current Republican Party. And to the degree that you get people like RFK who can now credibly be called a future health leader for it. I want to just end on one last question, because this is where I'm very much interested in your insights. Let's say in theory that this works, like Kennedy gets a fairly elevated health post. He and the rest of the Trump administration do actually crack down on vaccine manufacturers, make them more liable. They pull the plug on some of the vaccines, they take them off the market. What is the actual public health repercussions here in sort of granular details? What are we actually looking at?
Sam, it's going to be the convergence of a few things. One, you're going to see if CDC mandates, if say Robert Kennedy were to come into a high level position, the CDC currently mandates a certain vaccine schedule for children. If that suddenly goes away, and now state and local health officials say, hey, I'm no longer required to be talking about this battery of vaccines. And you can imagine maybe that's going to fall across political lines and political leanings. Oh, great, I don't have to listen to this anymore, something that perhaps they disagreed with. Then you're talking about things that are, say, happening in communities in Florida, where, by the way, the state Surgeon General probably would become the United States Surgeon General, Joe Ladapo. My understanding is it's not just Kennedy; it's the second order.
Right.
It's going to be people like him amplifying a similar message. So it's going to be grievous across the board. There's going to be few reasonable voices that are speaking to 70% of the country, or 65 to 70 based on
60. Let's decrease.
Let's say 60. But to your point, it's no longer going to be the edge case community in Florida where we've seen outbreaks of measles that, by the way, can cause a 15% hospitalization rate in children. This is not something to screw around with. You're going to see flu rates have declined post-pandemic. You're going to see that continue to happen. And this is happening. This is converging at a point in time where, by the way, the capacity of children's hospitals to actually care for children in an inpatient facility has never been lower in relative terms, because it's not profitable to operate children's hospitals. It is way more profitable to transfer those beds, Sam, to adult beds, because that's much more profitable than hospitals. Hospitals are struggling across the board. So you're seeing the ability of us per capita care for a rising burden of disease that didn't previously exist because these were vaccine preventable. And let me just emphasize, lastly, all the people that are pushing forward these topics, they are not what I think anybody would view as an authority in healthcare. They're not credentialed, practicing physicians actually caring for patients in a healthcare setting. They're not part of a legitimate organization like the American Academy of Pediatrics putting out guidance year over year. By the way, a group of pediatricians at the highest levels of their field now leading that type of organization. No, they have no credentials to speak of. They aren't credentialed to care and do anything for a patient in a healthcare setting. They don't see patients to begin with. And that doesn't just go for RFK Jr. That goes for many of the people you hear as potential nominees under a second Trump term, including potentially Joseph Ladapo as his future Surgeon General. A classic example of somebody that wears a white coat but hasn't actually cared for a patient in decades. And that's a problem here. Because if you have your leading healthcare officials either have no clue of what they're doing at the bedside because they've never cared for a patient or haven't done so in a decade plus, in the case of Ladapo, then you're going to get a group of individuals who are not moderated in their tone on what they talk about. They have no incentive to build consensus and to rebuild trust. And they're going to go after red meat issues to a fringe base. And that's the problem here. Also, because they're not going to actually have to ever directly deal with the consequences of what they're putting out there at the bedside. If they did, they'd be a little bit more careful, I have no doubt.
Yeah, no, it's fair enough. All right. Thank you, Vin. Appreciate it. Really, really appreciate it. I'm sure we'll be talking a lot more about this.
All right, man.
If Trump does win. All right. Thank you for tuning in, guys. As always, please do subscribe, and we'll talk to you later.